Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to another episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, a lactation consultant, a midwife, registered nurse in Keyport, New Jersey. I have to change that New York intro. Today, I'm going to talk to you about a very heavy topic, but hopefully I'll give you some solutions as well. We're going to talk about why tongue tie is particularly challenging for assessment and treatment for medical professionals, especially for lactation consultants. I'm going to talk to you about 5 different points, and each point I'll have a solution, okay? So for point number 1, why is this controversial? I'll say inconsistent training and guidelines. Unlike other areas of infant care, training about tongue tie is often limited and varies widely across medical and allied health fields. Some professionals may only receive brief exposure to tongue tie during their education, and it's not uncommon for lactation consultants to rely on independent study or continuing education courses to deepen their understanding. The lack of standardized, universally accepted guidelines means that lactation consultants can receive conflicting information on best practices, which may affect their confidence in assessing and recommending treatment for tongue tie. This inconsistency in education makes it challenging to establish a uniform standard of care, leaving professionals to rely on their judgment in a field with varied opinions. Solution for that is seeking out specialized continuing education programs like the Tongue Tie Experts Professional Guide and there are so many lovely programs. You want to look for a program that provides in-depth, evidence-based training on tongue tie assessment and management. You want to collaborate with other professionals who had advanced training in tongue tie And this can also help you to refine your skills and get a broader perspective on current practices. Joining professional organizations or networks that focus on tongue tie and breastfeeding can help you stay updated on emerging research and protocols. And I'm going to shout out ICAP for their ongoing research and writing of protocols and standards of care. So I will put ICAP in the show notes. And if you haven't already joined ICAP, I highly recommend being a part of that amazing organization. We have other episodes where we have interviewed people from ICAP and the work they're doing and the research that's going on. So if you want information on that, just message me, send me an email, and I will point you in those directions. So number 2 is difficulty in assessment. And assessing tongue tie isn't always straightforward, as it can impact feeding differently in each infant. Tongue tie may be associated with latch issues, painful breastfeeding, or poor milk transfer, yet the visual presentation of a tie can vary. As I say often and teach in my courses, this isn't about what tongue tie looks like, it's how it functions. Lactation consultants must evaluate not just the physical appearance, but the functional impact of tongue tie, which often requires advanced skills in observing the infant's oral mechanics during breastfeeding. A tie that appears subtle may still impact feeding dynamics, making accurate assessment a complex task. The ambiguity between anatomical appearance and functional significance can make lactation consultants hesitant to recommend treatment when it's unclear whether the tongue tie is truly affecting feeding. And we never want to intervene or treat something unless we're absolutely sure, right? And we can't always be absolutely sure. Investing in additional training specifically focused on functional assessment of tongue tie can be helpful. You can also use tools like the assessment tools that exist, and I go over all of the assessment tools, or a lot of the assessment tools that are used currently in practice in the Professional's Guide to Tongue Tie. Regularly practicing assessments and seeking feedback from more experienced colleagues or mentors can also build your skills and confidence over time. So I learned so much when I started networking with other professionals, which is why I have a group associated with Professionals Guide to Tongue Tie, where we can all collaborate, share opinions on cases, share experiences on cases more than opinions, and get feedback from other providers. Also, and we'll talk more about this later, local groups can help as well. And following experienced providers, both virtually and in person. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much. So the third reason that tongue tie treatment and assessment is often controversial and sometimes difficult is that there are disagreements or different points of view between different medical specialties. And this is a big one. And I can do an entire episode on this topic, but there is often significant disagreement among medical professionals on the severity, importance, and treatment of tongue tie. Not to call anyone out, but as examples, pediatricians or ENT specialists may dismiss a tongue tie as unproblematic, while lactation consultants observe ongoing feeding issues that can be related to the oral restrictions. These differing opinions can create tension and complicate the referral process, making it difficult for lactation consultants to guide families effectively. Moreover, since tongue tie is not always viewed as an impactful health concern by all healthcare providers, families may face delays or barriers to treatment, leaving lactation consultants in the challenging role of advocating for timely and appropriate care while struggling to stay respected by other providers in their communities. The solution, in my opinion, to this challenge is open communication. Engage in respectful, evidence based conversations with other healthcare providers involved in the infant's care and share research articles or clinical experiences when appropriate. Developing a referral network of professionals who understand the impact of tongue tie on breastfeeding can also help families access consistent care. Whenever possible, work collaboratively with professionals who have a range of perspectives on tongue tie, as this can help bridge understanding and reduce conflicting recommendations for families. Now, I know this more than anyone because when I started working in my local area, there was nobody who practiced the way I wanted to practice. There was very little options and nobody understood what I was saying. So I blocked out the noise of the naysayers and just tried to do what I felt due to my experience and learning and intuition on some points felt like the right thing to do. And the results that my patients got spoke for themselves. And then they would speak to other providers. And then it was a ripple effect. And also, they would speak to each other. So, parents advocating for each other, which brings me to the next hard thing about tongue tie assessment and treatment. And it's pressure from parents and families. Families struggling with breastfeeding issues can often experience frustration, exhaustion, and a strong desire for immediate results. Lactation consultants may feel pressured to provide definitive answers or solutions quickly, especially when feeding difficulties are severe. And I think dentists who are performing laser frenotomy often feel that same pressure. They may know that this is a multifaceted solution, but they want to help those parents who are looking for an immediate relief. With limited conclusive evidence on tongue tie treatments, depending on what evidence you're looking at, and potential for conflicting opinions among providers, some lactation consultants may find it challenging to meet the expectations of parents who are seeking clear, definitive answers and, again, immediate relief. The emotional nature of breastfeeding issues adds to the pressure on lactation consultants to make a recommendation that may have lasting impacts on the family's feeding journey. The solution I recommend for that, to help manage the expectations, you want to provide families with clear, compassionate explanations about the complexity of tongue tie and why a thorough assessment is needed before deciding on treatment. Offering educational resources such as handouts or access to webinars can also empower families with knowledge, helping them feel more informed and supported. It's why I do what I do. It's why I include parent education in everything I do. And in the Tongue Tie Experts platform, we have resources for both parents and professionals. As a matter of fact, we have one handout that's called Preparing for the Day of Phrenotomy. I will put that handout in the show notes today. And if you're listening to me on Instagram, you can message me and I will send you the link for that. Okay. Now, you want to also schedule follow-up for reassessment that can reassure families that their concerns are being heard and addressed over time. It's very important. Education and communication and helping families feel like they have someone who understands is vital. The next point that I will cover today, and the last point that I will cover today, is the limited access to qualified providers. And I'm trying really hard to educate as many multidisciplinary, interdisciplinary groups as I can so that we have an increased access to qualified providers. But even when a lactation consultant identifies a tongue tie and recommends treatment, finding a qualified provider who understands the complex needs of breastfeeding infants and their parents can be a struggle. In many areas, specialized providers experienced in tongue tie evaluation and release may be scarce or have long wait times. Some people drive miles and hours to reach treatment options that are what has been recommended for them. So without adequate referral options, as a lactation consultant, you can feel limited in your ability to provide effective support, and you may feel frustrated that you can't facilitate a full continuum of care for your families. This gap in the availability of skilled professionals limits the success of interventions and can lead lactation consultants feeling isolated in their ability to support affected families comprehensively. The solution that I recommend for this is, first of all, network and be sure that there's not a specialized provider near you. There might be. You just might not have found them yet because they might be in the same place that you are. You can also explore options for virtual consultations. You can also consider connecting with professionals who are willing to provide long-distance guidance on recommended aftercare protocols because that bodywork piece is often the challenge to find. And when possible, advocate locally for increased training and availability of skilled providers so more families can access the care they need. You can also create a referral list of the closest providers who specialize in tongue tie treatment to simplify the process for families. And I have this. Any patient that comes to me gets a list of the resources in the different categories of providers who provide care locally. That is a beautiful way to recommend and refer without being accused of having one special person that you refer to, which I have been accused of. But that's a story of another day. Okay. So all of these points underscore the importance of improved education, collaborative care, and accessible resources to support lactation consultants and other professionals in meeting the needs of families facing tongue tie challenges. It is my hope that these solutions can help you navigate these challenges more confidently and provide families with the support that they need. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.